Hello, I am Marwan Aburas. Step 4 in the 4ROD protocol emphasizes the importance of evaluating both the restorative status and the tooth structure itself. You know, no endodontic treatment is complete without a quality restoration. So, since the 1980s, significant progress has been made in the subject of evaluation of restorations. In this presentation, I want to share with you what I personally use in step 4 of the protocol. I use the 2023 FDI criteria for evaluating both direct and indirect restorations. In just a few minutes, I will describe the origin of these criteria, how they are structured, and how they are applied in daily practice. This presentation introduces criteria only, but for more detailed description of the criteria and their importance in endodontics and restorative dentistry, in oral health in general, I have organized 3 separate presentations available in the 4ROD Masterclass. Let's begin with a bit of history that I have lived. In the 1980s, Gunnar Riggi, and the 1990s in the United States Public Health Service introduced well-known criteria, which focused mainly on marginal integrity, restoration, retentions. In 2010, the FDI World Dental Federation had developed a broader framework organized into 3 domains: functional, biological, and aesthetic. The 2010 criteria were used globally for about a whole decade. But in 2023, the criteria were revised. The 2023 criteria, which we use today, focused on 3 major revisions. First, it reversed the criteria prioritization from aesthetics, biological, and functional to functional first, biological second, and aesthetic third. Second, it uses 5-point scoring scale ranging from acceptable restoration to non-acceptable, repairing requiring, or replacement requirement. Third, in that criteria is a detailed description of failure analysis patterns in every material we use. This integration enables you, the clinicians, to evaluate restoration systematically and communicate the findings to your patients and colleagues. In summary, the 2023 FDI criteria build on decades of research, and they created a comprehensive, standardized, universally acceptable, patient-centered 3 domains: function, biology, and aesthetics. By adopting this systematic overflow based on these updates, you, the clinician, will evaluate both the restoration and the endodontic outcomes, achieving more reliable assessment, clearer patient discussion, and quality restorations. I want to thank you for your attention, and let's move forward together using the 2023 FDI criteria as a foundation for excellence in endodontics and restorative endodontic care. Thank you for your attention.